Yes, I have it.
It's recording now?
Yes.
Okay, we can go ahead and get started.
Okay, today's webinar, in today's webinar, we're going to discuss using the CLNA to identify identify equity, racial, and opportunity gaps. Okay, and I just want to, again, remind everyone of what OCCRL's mission is. We are equity driven. It's at the core of all that we do. We also have a commitment to public engagement, transformative leadership, and comprehensive P20 educational pathways. So today we're going to define some terms for you. So we're going to do a really good definition of equity gaps, racial equity gaps, opportunity gaps. We're going to make sure we begin to understand data-informed decision-making and equity-conscious data cycling. And then we're also going to look at some examples, some useful examples of data and using data-informed CLNA. Okay, and as we talked about last week, equality and equity are not the same thing. I thought this quote from a PTR practitioner really got to the heart of the matter. The practitioner said, equality is talking about equal access, but equity, we're really talking about really leveling the playing field. And so equity brings to mind the idea of not just equal access, but it's also to have outcomes that can't be determined by student characteristics. Okay, and so an equity gap is defined, we define that as differences in outcomes at the program, department, or institutional level that show a lack of parity among subgroups within the student or community populations. And so by that, I mean when you compare students against student groups, and also when you compare the students in your institution to the demographic population outside of the institution. And in order to look at and find equity gaps, it requires both quantitative and qualitative data collection, because you want to identify the gaps and also the processes and procedures that are contributing to those gaps. And also you would need those kinds of data to find possible useful modes of redress. And so basically, equity gaps is looking at differences in completion rates, board pass rates, application rates, and acceptance rates, examples such as that, based on subgroup categories. Racial equity is defined as having a systemic assessment of how racially equitable systems that uplift and increase access and opportunity for historically minoritized people of color are equally ingrained into the academic and social practices, policies, and structures of an institution. So we believe that you've come close to racial equity when it's infused into every part of your institution. And racial equity gaps are just the same as the equity gaps that I've just defined for you, but based on racial categories. And so in order to find a racial equity gap, you have to know that it's based in past and present systemic, both implicit and explicit racism that is woven into the fabric of every level of our higher education system. These gaps are also often obscured and discussed under more palatable categories, such as you might not say Latino students are underperforming in a particular category. You might say students from this particular socioeconomic status or students from this particular neighborhood. It's easy to use other characteristics, other adjectives than the racial category. And so when we think about what an equity-minded practitioner has in mind and what they do, these are just some of the examples of how an equity-minded practitioner would think, right? So I won't read all of them, but an equity-minded practitioner is aware of the socio-historical context of exclusionary practices and racism in higher ed and the impacts of those contexts on opportunities and outcomes for racially minoritized students. They're aware that seemingly neutral or objective policies and practices left unexamined often obscure barriers that create these differences in outcomes. They abstain from, really importantly, they abstain from blaming students' race, ethnicity, or culture for those accumulated disparities. Lastly, equity-minded practitioners use clear language to say what they mean about equity. Race-conscious language as opposed to race-evasive. Equity-minded practitioners don't hide from the language that adequately describes what's going on.
So now we are going to go from this idea of equity and racial equity to examining this idea of gaps. There's this notion of the achievement gap that has been central to the study of racial inequality within P220. But there are also two other ways of exploring these racial gaps. These are the opportunity gap and the education debt. We need to include multiple views to close racial equity gaps within higher education pathways, especially for students of color. When we are examining data, specifically the ones attempting to close racial gaps, uh, we must move away from centering individual students in the examination. Rather, we should focus on systemic barriers that often lead to racial inequalities. So if we go to the next slide, we'll show what that means. So again, rather than blaming individual students, let's look at these systemic issues that has come from a very long time. And this quote kind of encompasses what this means. Closing the achievement gap implies that the students are the cause of the gap. And instead, practitioners should use the term equity agenda because the lack of success of our students of color is a systematic issue resulting from inequitable practices, not only within educational settings, but also as a society as a whole. So switching to the less deficit term equity agenda calls attention to this larger problem. Therefore, instead of using the concept achievement gap, we encourage P220 leaders to use the concept of opportunity gap to frame their equity discussions. So also we need to look at achievement gaps versus this idea of opportunity gaps. Um, for example, achievement gaps emphasizes external explanations. Achievement gaps often play the blame game for the inequity students of color face. It also focuses strictly on student performance or outcomes, such as scores on standardized testing or even credit completion. Rather, we should focus on how the social context of the student shape opportunity rather than focus primarily on the students themselves. When we look at opportunity gaps, now we're talking about internal explanations. So what opportunities to learn are we not offering the most marginalized students? Specifically when we talk about racially minoritized students. The opportunity gap accentuates the ways in which students actually do their very best to operate within structures that we have created. Sometimes many students get stuck in the structural barriers that we have created without their input, or that these were created for other populations. So rather than placing blame on individual actors, on these specific students, we must accept responsibility for these inequitable structures. In the last webinar, we mentioned that how organizations are inherently racialized. Therefore, we need to consider how we approach this idea of gaps from a more systematic manner that is more nuanced, but that also takes a strength-based approach to address student inequities. And I won't go in the achievement gap because I have covered that already, but I want to really talk about this idea of the education debt, which centralizes historical and systematic explanations. Gloria Lanson-Billing calls this an education debt. It centers the idea that educational inequities students of color experience, that they didn't happen overnight, but that they have manifested over long periods of time. So for example, if we take a look at the US national debt, it doesn't start fresh every year, but it is something that have accumulated interest over a long period of time. So in order to balance the budget, we must pay down the debt, which takes form in historical and systematic explanation of racial inequities. And just to provide a case in point, an example from the healthcare industry, there was this report published in 2004 by Alan Nelson called Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare. And this was one of the first reports dedicated to understanding injustice within healthcare. Since then, it has been cited over 6,700 times, and there's definitely hundreds of initiatives to reduce racial inequality within healthcare. So this is what Jonathan Betancourt did. He did a root cause analysis to address racial disparities through cultural competencies. So what he did, if you look at in the left of the table, he said root cause of disparities, and then he broke it down into 3 different areas. So health system level factors, care process variables, and patient level variables. And then he wrote, what is the root cause, for example, in care process variables. In the second one, he says provider stereotyping of patients leading to different recommendations for diagnostic or therapeutic procedures, right? So, for example, we often see that Black women are, not treated for breast cancer at the same rate as white women, for example, right? So what do we do then? So in order to address them, then we engage in curricula on the impact of race, ethnicity on clinical decision-making, right? So in a way, you are actually not only understanding the root cause, but you're also putting something to a strategy to address them. And you can go to the study highlighted here, and this is a good practice. So I'll pass it on now.
All right, thank you, Francena and Angel, for starting us off. So they talked about identifying equity gaps, racial equity gaps, and then acknowledging that those gaps are a product of opportunities that we have not provided in our institutions, okay? So in order to identify equity gaps and racial equity gaps, you need to use data. You need to use data to identify these gaps. So we thought it would be important just to provide you some key terms and concepts related to using data to inform decision-making. Data-based decision-making is institutional stakeholders collecting and analyzing various types of data, including demographic data, looking at administrative data, looking at your processes, getting viewpoints and feedback and perceptions from people, maybe through surveys or focus groups, and then looking at achievement data to guide a range of decisions to help improve the success of students. And what's key about this is that as Angel talked about before when looking at the achievement gap, one fatal flaw mistake that people often use when using data to inform their decision-making is that they only use one type of data. But you should have multiple forms of data to inform your thinking, because you should have multiple perspectives and multiple ways of understanding the problem. It's kind of dangerous to just look at one type of data. You could make some huge assumptions if you look at one type of data to understand a problem. There's also the concept data informed, and researchers who do research on data-driven decision-making, they're trying to push us to use the term data informed instead of data-based or data-driven decision-making, because the term data informed, since data alone does not drive our decisions, it's rather individuals who use the data for inquiry. right, to be reflective and to help inform how they will address a specific problem. So data is helping us inform and help us ask questions to address a problem. Also, when you're using data to identify equity gaps and racial equity gaps, it's important that you establish a culture for doing so. You need to make sure that you create norms and capacity building for your faculty and staff to be able to use data to inform their decisions. So a data culture is a learning environment within a community college, a school, that includes attitudes, values, goals, norms, and behaviors and practices accompanied by an explicit vision for data used by your leadership that characterizes a group's appreciation of the importance and power that data can bring to this decision-making process. And so, you know, the leadership really needs to model that for the rest of the campus, for the rest of your department, that using data is valued and is important. And then there's data literacy. Using data is, you know, often working with practitioners in K-12 and in higher education at community colleges. You know, using data isn't something that they have actively learned how to do. And so we need to provide professional development to promote data literacy, to understand how to effectively use data to inform decisions. And oftentimes, I know this happens at community colleges where you rely primarily on your institutional research office to you know, examine data and compile reports for you. And so by doing that, you yourself as a faculty or staff member don't build your data literacy. And so we all should be involved and learn how to effectively use data and how to collect and analyze and make sense of data to inform our decisions. So when I work with P20 institutions and do workshops on data-informed decision-making and how to create a culture for using data, I often recommend that they create some non-negotiables with their staff. That there should be, if you're going to create a culture for using data, there should be a non-negotiable that you're going to make time for this work, and you're going to make space for having critical dialogue and action towards equity. So part of that too is, you know, acknowledging that inequities exist in our own backyard, just as Angel talked about previously, that we should, and Francena mentioned this as well, that we shouldn't do the blame game. When we identify our equity gaps and our racial equity gaps, we shouldn't do the blame game of blaming students, but we should be willing to acknowledge that inequities exist in our institutions, and that there are structures perhaps and our own practices perhaps are creating these inequities that students are facing. Okay. And then Angel provided an example from the healthcare field of doing a root cause analysis. So oftentimes I see that you know, when you're using data, you don't really get down to the root of what the problem is, and you just treat the symptoms, right? You just put a Band-Aid on it. You don't treat the disease. You just treat the symptoms and don't get to the root cause. So this is not Band-Aid kind of work. This is not quick fix kind of work. Data-informed decision-making and looking at your equity gaps and racial equity gaps requires you to be reflective and think deeply about the structures and the practices at your institution and how they might be creating these inequities. And so because it requires you to be introspective, this means a non-negotiable should be, it's not necessarily going to be safe or comfortable, and that you really need to be willing to have you know, forthcoming conversations and be open and honest about the inequities that exist perhaps within your institution. Okay, so you need to create a culture and space for having critical dialogue and reflection around data, and then take action based on the inequities that you uncover when you examine data. And then something else I often recommend to institutions when they're working on creating a data culture, a data-informed culture, is to also think about what their undiscussables are, and what is it that they often they frequently brush under the rug, and things that they often are unwilling to talk about. And so make a promise and make it a value and a norm and a non-negotiable that you are going to be willing to discuss some of those undiscussables when engaging and being reflective about data and using data to uncover your equity gaps. And oftentimes the reason why we have these undiscussables is because we're trying to avoid addressing our problems, because we might truthfully know that we are part of the problem, that we have created structures and practices that may be harmful to certain student groups. And that sometimes is a hard thing to face. And so that's how sometimes they become undiscussables. We avoid talking about them. It's a form of protection. We're hiding our flaws. And so when we have these undiscussables, things don't change and the status quo remains. And these undiscussables actually are an inequity in itself. It is harmful to our students because it doesn't push us to change, right? And so equity-driven data use, if you're using data to uncover and unearth equity gaps and racial equity gaps, you really need to be able to be willing to adopt an ethic of critique and consistently and continuously be reflective and be willing to challenge existing norms, biases, and practices, and also be willing to radically restructure the way you do things so that it's better for students and more equitable for students, and be willing to create a new normal. So these are just some examples coming from pulling in some theory here from organizational theory. The image on the left is what it looks like if you maintain a status quo and you just kind of stay in this loop and don't change your norms, your structures, and practices. And then the second image is, if based on looking at your data, you recognize that there is a problem, and based on that inequity that you unearth, then you decide what types of structures do I need to change? How do I need to change my practices? And then that step 2B is your willingness to change as an organization, and your willingness to learn new practices, to learn new instructional practices, whatever the new thing is that you need to adopt and change in order to be more equitable for students. And then eventually, hopefully, that shift will become your new normal, right? Okay. So here I just have some examples of ways in which to examine data. There's a lot of different frameworks out there. Using data to inform your decision-making should be a continuous improvement process. It should be a cycle. And one example of this is an equity audit. And an equity audit is a practical tool to make for educators to apply and make sense and examine their biases. And equity audits are intended to facilitate ease of use and to promote insight into discussion of, and it's a substantive response to systemic patterns of inequities in educational settings. And so the equity audit concept comes from the Office of Civil Rights, the U.S. Department of Education Office of Civil Rights. They would use an audit to audit campuses, institutions to examine civil rights violations. And so the P20 institutions have adopted this idea of an equity audit to really it's kind of like doing a routine physical to determine the equity health of your community college. And scholars who write about doing equity audit and who have developed the framework of an equity audit have proposed these 5 different phases: bringing stakeholders together, gathering data and presenting it to a group, openly discussing the data and the equity gaps that were revealed, developing solutions, and then implementing solutions and monitoring results. So this similar type of process this cycle is what we hope that you do when implementing and going through the comprehensive local needs assessment. We here at the Office for Community College Research and Leadership, we also have a similar equity audit type of process called Pathways to Results. And I know many of you have engaged in the Pathways to Results process. And similar to an equity audit, first you collect data, you identify equity gaps, you describe the problem, analyze institutional processes and practices, and then review and reflect. So as I said before, using data to inform your decision-making should be a continuous process. It's not a one and done. Like, I've collected data, I figured out what the problem is, figured out what the root cause is, decided, what changes need to be made in terms of my structures and programs, implemented those changes, and then I'm done. No, you can continuously need to be reflecting, evaluating, tweaking, and improving. And so it is a cycle. And so this is another example of a cycle that I adapted and have used with my work with P20 practitioners and professional development on how to use data. And so first you collect and you prepare data, and when you collect and you prepare data, you're examining a variety of data to uncover the inequities. Remember, I said that you shouldn't just use one type of data, but you should try to get multiple forms of data to help you understand the problem, because community colleges are complex places, right? Our students are complex. They are complex beings. And so in order to understand the full extent of the problem, you're going to need multiple data points. It's like I said, it's dangerous just to rely on one data point. But also you should avoid neutrality and use data to take a hard look at especially racial inequities. In our first webinar on the CLNA, we talked about how in the CLNA process, of course, we want you to look at all student subgroups, but we have found in our work with community colleges that no matter what your institutional type is and your demographics are, that race is often the thing that practitioners avoid discussing or are afraid to discuss. And so we really encourage you to use data to really take a hard look at those racial inequities that may exist at your institutions. And then that second part of the cycle is to interpret the data and dialogue about and determine what the data means. And you should be doing this collectively, collaboratively, not in isolation. So doing this with your stakeholders. And as you're talking about the data and examining the data, try to, as Francena and Angel already mentioned, avoid deficit explanations of the data, avoid using external explanations that blame the students, and try to look internally to see what it is within the institution that is the root cause of the inequities that you're seeing in the data. So that is the next step. In terms of looking internally, you're critically reflecting on systemic reasons. Angel talked about looking at it systemically, the problem systemically. So considering structural, attitudinal, so maybe it's biases that could be the issue, interpersonal, could it be our relationships with students, What are the explanations for data internally within the institution? And then the next step is you're going to develop a hypothesis to improve student opportunities. So what are some possible, based on those reasons, those systemic reasons that you identified, what are some possible changes that should be made? And when you're thinking of these changes and solutions, try to avoid quick fixes. Again, don't just put a Band-Aid on it. Really try to think of changes and solutions that will really get at the root cause. And then you modify and change. So you modify structures, programs, and instruction, and perhaps instruction to improve. And in this case, I'm saying student learning. It could be student retention, whatever the problem is. And then you repeat the cycle again. So this is an example of a racial equity gap. So this is a hypothetical example of a community college that is examining their developmental courses and looking at they're looking at the data, the breakdown by race, a percentage of students enrolled in developmental courses. And as you can see, there is the racial equity gap is that Black and Latinx students, they have high percentages of enrollment of Black and Latinx students in developmental courses. But remember, I said not just to focus on one type of data to understand the problem. So to really get a full picture of this problem, this institution is also looking at their completion rates. And looking at the students who have not completed and are no longer enrolled. So these are students who have not completed and they are no longer enrolled in this particular program, this hypothetical program. We see that Black and Latinx students are also, there is a racial equity gap. And so obviously you could make a connection that, right, a hypothesis that the overrepresentation of Black and Latinx students in developmental courses is tied to them because they're stuck in these developmental courses. They aren't completing and they're leaving the program. So then what would this look like once you've examined data? What would this look like in the data cycle? So obviously you've done the first step and you've collected the data. And as I said before, getting a variety of data. So you're not just relying on looking at the percentage of students based on racial subgroup enrolled in developmental courses, but you're looking at completion rates as well. So multiple forms of data. Interpreting the data and what does it mean? So you're dialoguing with as a team about the data and trying to determine what it means, and avoiding deficit oriented explanations about the data. So it could be that so you remember you're looking internally, being introspective about what's going on in the institution that could be the root cause. So it could be that in terms of what the data means, it could be that there's a lack of culturally responsive instruction. Maybe there's some implicit biases, implicit racial biases in the student advising and advising students into these, tracking them into these courses. Also the placement testing and the placement processes, maybe there's racial biases in the placement testing and the placement processes and in the advising. So again, you're critically reflecting and looking at structural and institutional, attitudinal, that's the biases piece, interpersonal, your interactions with students and that advising process and placement process that could explain what's happening, what you're seeing in the data. So again, you're reviewing placement processes and practices. And then the next step is you're developing hypotheses about what to do and what changes need to be made. And when you're doing this, again, you're avoiding quick fixes. You're trying to really treat the root cause and coming up with changes that will really address the root cause of the issue. So perhaps some ways in which you could modify the structures, programs, and even the make instructional changes would be to improve instructional capacity of your CT faculty to be more culturally responsive. So maybe there's an issue that your CTE faculty don't know how to implement culturally responsive practices for students of color. And so students aren't connecting to the curriculum, and so they're getting trapped for that reason, because the instruction isn't strong. They're getting stuck in those developmental courses. PD for advisors on implicit biases. So helping advisors understand perhaps their own racial biases and how that might impact how they're advising students in their course taking. Culturally responsive wraparound student support services and academic support services. So what kinds of interventions and academic supports could you provide for students of color? Contextualizing the curriculum. So making the curriculum more so connect to the certification that they're getting. And also collaborating with K-12 and adult ed, not to, of course, put the blame back on K-12, but, you know, if you're seeing patterns, perhaps there could be some collaboration in terms of providing interventions and supports for students that are matriculating to you. So in conclusion, in terms of creating a data-informed culture, I do suggest that, you know, you regularly meet with your institutional research office to learn about some of the data that perhaps is available to you. And also there's ways in which you can, just as Francena said earlier, in terms of identifying equity gaps, it's not just quantitative data, but it's qualitative data. So there's things that you can create, that you can create to collect data. You can do focus groups. You can do simple surveys. But you need to dedicate time to do this work. You need to dedicate structured time to collaborate and take a look at your data. You also need to make sure that all staff have a clear understanding of your goals for using data and the purpose of it. And as I said before, provide professional development for your staff and faculty to understand how to use data to drive their decision making, and to be data literate, to improve their data literacy. And so to get good at using data, you must continuously practice it. It's not something that is like a one and done. You know, don't just use data when you're trying to prepare you get ready to prepare your Perkins 5 local application, right? You should be continuously using data to improve as an institution and making sure that you're providing equitable opportunities and structures and practices for students.
All right, thank you. This is Marci Rockey, and I'm going to look at the actual sections within the CLNA and just kind of briefly talk about some resources that might be helpful. And so as we're going through this, we do encourage you to use the chat box. So if you have thoughts on data that you're using or resources or tools, we encourage you to share that as a group. And so you can have that conversation through our chat box. And also, there was a learning community call through ICSPS on the CLNA. And so these notes from that call actually came from experts in the field. So Patty Zuccarello at Joliet Junior College and Bonnie Campbell at Illinois Valley Community College shared their thoughts on how you might approach each section. So repeatedly, we're going to refer to that call, but these ideas and these thoughts came from them. So I want to be sure to point people to the recording of that call, because it is available and it's linked on this slide, which these slides will be available later. So if you didn't hear it, and even if you did, I think that's a great resource as you're approaching this. So as we look at section 1, looking at progress toward equity and access, some of the things that came up on that call were your environmental scan that you have for your institution, looking at your program reviews, and if you have an annual update process or an annual review process that coincides with program review, that can be helpful to you. And then any kind of student surveys that you are collecting in CTE. So looking across CTE to see what might exist for that. And then also I wanted to connect people to some recent reports, and actually one of them just came out today. But the Partnership for College Completion has a series that's based on the impact of state disinvestment in higher education in Illinois and how it has made equity gaps worse, and particularly for Black students, Latinx students, and rural students. And so we know that those subpopulations overwhelmingly rely on community colleges to access higher education. And so there are separate reports for each of those subpopulations that look at Illinois as a state. And so that'll give you, it's a state view, but I think it will be really helpful to many of your institutions. And I would encourage you to look at those reports that are now available. So section 2, student performance. Again, program reviews, annual updates. And also if you don't have a process to doing annual updates for program review, again, I would encourage you to look at that call. And then we also have some resources related to program review through OCCRL, but that can be an opportunity for you to use those for your CLNA. And then also this is linked on the actual CLNA, but the NAEP Equity Gap Analysis Local at a Glance tool. So it actually helps you facilitate a gap analysis based on your local data. So it kind of walks you through that process. So that can be a really great tool as it relates to looking at your student performance data and identifying those equity gaps. And then when we go to section 3, recruitment, retention, and training of CTE educators. Again, on the call, it was suggested that you partner with human resources. And when we think about engaging our stakeholders, this was identified as potentially an opportunity to actually have some opportunity to make change and to have some discussions that maybe you're not having at this time. So again, working with human resources to obtain and analyze data as it relates to this particular section, to help you look at, who you have within CTE education. How are you recruiting? Are you retaining faculty? How are you training faculty? And then another thought was, this is an opportunity to partner with your high schools. And so looking at who's teaching dual credit CTE classes. And again, as you know, that your K-12 partners are also going to be doing a CLNA, and that's a separate process and a separate form template through ISB, but again, that you're supposed to be engaging with each other and looking at this locally. So this is really an opportunity to take what you're learning and how it's informing your local application, and to partner with your K-12 partners and high schools to again approach this from a local standpoint. For stakeholder participation and voice, while this is a listing essentially of who participated in the process, the title, and then how they were involved. So again, thinking about how you're involving different stakeholders. You're going to have probably a central group that's primarily involved in this, but you're going to be engaging people in different sections. So whose voice is still underrepresented? And again, if you're thinking about your advisory committees and you look at different CTE programs, And perhaps there's never been discussions about, you know, having advisory committees that are very homogenous, whether, you know, especially by race, by gender, looking at employers. So whose voice is not, you know, at the table? Who's not being engaged in these conversations? Who's underrepresented, particularly when you look at racially minoritized groups and economic opportunity and employment in your area. So again, really being purposeful about how you are engaging stakeholders and who you are engaging, and not necessarily relying on just, you know, perhaps people have been on an advisory committee for a really long time, but it's a very homogeneous group, and you see in your data that there are equity gaps. So how do you really engage people in a purposeful way to ensure that you're getting those people that may be underrepresented or haven't been able to give input? Section 5, labor market alignment. Again, advisory committee feedback can be helpful in this. And then from the learning community call, there's a lot of opportunities for partnerships. So looking at your adult education, K-12, your program coordinators in CTE. So as it relates to sometimes the challenge of getting information from graduates or knowing about, you know, post-completion outcomes in the labor market, that again, maybe through employers that might be on your advisory committee, but also through your program coordinators that might have personal relationships with students, and may be able to get feedback from them, that can be a resource that you can tap into. Your disability services office, and again, even your local partners, your regional and local workforce boards. And then we have a few examples here of different resources that are also listed on the CLNA. But again, as has come up in different meetings to engage stakeholders and particularly get data for this, that really looking to leverage relationships with regional and local workforce boards, because you may not have access to certain labor market data that they may be able to help you get access to. Or you could engage them in a way where they could share that information with you. And then program size, scope, and quality. Again, what was suggested was looking at that program review, annual updates, and that can be a resource for you, and particularly as you look at the definitions that are provided as they are finalized in the coming months as it relates to size, scope, and quality. And then progress toward implementing programs of study. Again, partnering with K-12. So we really, of course, the theme here is partnerships with lots of different partners and workforce. And so looking to obtain and analyze data on the transition from dual credit into college, that might be an area that you want to look at. And again, your K-12 partners are doing their own needs assessment. And so what we hope is that you can talk to them, and between all of those, you can look at this in that local way to advance equity throughout your district. And then we also have linked here, which are linked on the CLNA, the principles to guide career pathways and programs of study implementation improvement, and then advanced CTE programs of study. So again, resources that can help you think about what kind of progress you're making to implement programs of study. And these are our references, but at the same time, we wanted to let you know that we will have additional resources that are coming. And so we have a website to support you with the CLNA that'll have resources, and that's currently under construction. So it should be available soon, and it will include this webinar as well as the other webinar and links to a lot of the different resources that we have been talking about. We will also be hosting professional development events in the spring of 2020, and so we're looking for those dates and locations to be confirmed soon so that we can get those out to you. But again, really focused on equity and looking at how to support institutions as they're doing the needs assessment, as they're doing program review, and also incorporating tools that we have from Pathways to Results. So that information will be available soon. So we'd like to thank everybody for being a part of the webinar. And as I mentioned, more information to come on those resources. And please feel free to contact us with any questions. As you can see, myself and Dr. Welton are the two staff members that are leading this particular aspect of the CLNA, again, with support from many of our other staff members, including Francena, Angel, and so we are happy to respond to your questions. So thank you for being with us, and please let us know if you have any questions. Thanks for your time.